Okay, welcome everyone. This is the DSO Study Club. We are going to let people file in. We've got a couple of minutes. We'll probably do 3 minutes, give everybody a chance to get in, and then we're going to let Cory Pinegar take over. And he's working on logistics on his end, but just some rules of the road. We will not go past an hour, we promise. We'll have plenty of time for Q&A at the end. And we actually have had some great questions already come in from you all. So we appreciate that. So we'll make sure we've got time at the end to go over those questions. This is the future of dental operations redefined by hybrid teams. And Cory is the expert on that. So we're going to get his perspective on everything, best ways to implement hybrid teams, what he's seeing now that works well. I think maybe we can get a little crystal ball action at the end to kind of get an idea for what the future of hybrid teams look like, especially when it comes to the front desk. It seems like that's a big focus right now. Cory, thanks for being here.
Thank you. And to address the bear in the room, a conversation I think would be interesting while we kind of let everybody file in is there has been a lot of restructuring, bankruptcy conversations over I think during the early months after rate changes during COVID took place to begin inflationary reduction. And then I don't know if you feel, but I feel like over the last 3 to 6 months, there has been more bank involvement on some mega groups. I mean, there's some news about Harvest Partners acquisition and some other groups, but what that shows, these people, when you run a $1 billion or multi-$100 million group, you can afford the best operators in the world. But if the model of a DSO has to be different today because of debt and labor changes, if we don't change, even if you're the best operator in the world and you have a world famous logo of a private equity fund behind you and they're struggling, people have to play a different game. And so what I'm really excited to talk a little bit about today is how we believe practices and groups need to change to be with the times. The definition of insanity is doing the same thing over and over and expecting different results. And I don't know what you think, Bill, for the last 20 years, I think people could make minor adaptations, online scheduling, having a call center, using patient engagement tools, reading your radiographs with AI. Fundamentally today, the model of groups and even solo dental practices have to change to make the economics work.
Yeah, I agree. I think you've got a lot of different things at play right now. You talked about the interest rates climbing. COVID kind of kicked off this great resignation that really didn't come back much after COVID was passed. So we're still struggling with talent. Talent, of course, seems to want quite a bit more when it comes to compensation, and rightly so because of inflation. But certainly, we know that insurance providers are not giving you any more as a DSO or a dental practice and maybe they did 10, 15 years ago. So reimbursement is the same, maybe up the tiniest bit. So I think there's a lot of different pressures. And then, of course, I think generationally, people are dealing with, their jobs differently than they once did. So it seems like there's quite a bit going on. Just a couple other rules of the road here, and then we'll get things started. It looks like, yep, you look good on your end with the presentation. So we're good on our side. As far as you in the audience, we appreciate you joining us today. Thanks for registering. Like I mentioned at the beginning, we will go an hour. We will not go past that. We may even let you go 5 minutes early if you're lucky. We have plenty of questions that you have provided ahead of time. But if you happen to have a question, Cory's present something and you want to question it, or you've got a tough question for Cory, we've got a couple of great ones that came in from you all. But if you have any, just feel free to put that in the Q&A section, and we'll answer that right away. And then this is being recorded, and the recording will be on our YouTube channel, and then also on Group Dentistry Now. by the end of the day today, East Coast. So we're already a little late in the day, but we'll get it up by 5 p.m. Eastern. And with that, I think we'll get things kicked off here. Again, we have Cory Pinegar. He is the CEO and founder of Reach, and it's going to be a great conversation. Cory, I'll kind of let you kick things off, and I'll monitor the Q&A, and then we'll make sure we get to all those questions that came in towards the end of the webinar.
Awesome. Bill, thank you. You've been an awesome partner of ours. And the goal of my presentation over the next little bit is to educate people on things that we at Reach are able to see at scale. And I have owned and operated this business for almost 9 years now. We serve a couple thousand practices in total, have well over 1,000 team members around the globe. And really what I want to share a little bit about is what we started the conversation with, that your group needs to change. The world, whether it be labor market and or AI or debt, is vastly different today. And I grew up with a father who did extremely well in business and has run much larger companies than me. And I was chatting with him a couple months ago, and he mentioned, he's like, the acceleration of change that he has seen post-COVID from debt, labor, and AI is more rapid. He says, when I really think about it, the last 20 years were winning an inch forward or winning a foot forward. And then one day you woke up and you start seeing on all of your major news channels, there's a artificial intelligence called OpenAI, and it actually works. And you're seeing debt rates go from 3 to 6 to 9% or to even 12% for some of these groups. And so things are rapidly innovating. And what we want to share is what we believe some of those adaptations to run a successful practice in the future looks like. A little bit about myself. I am a born and bred entrepreneur. I love it. I love the idea that we get to help people solve problems. And if I can eventually get buried 6 feet under with my tennis racket and know that I helped move the world of healthcare forward, and also the way companies look at treating their employees, this was worth its weight in gold to me. I love the game. Like it truly is something that I am extremely passionate about. My reason I'm passionate about healthcare, my dad, since he was 46 years old, is a Parkinson's patient, which is a terminal neurological illness that you can't do anything about. Beyond the businesses that I own and operate today, I sit on the board for the Parkinson's Foundation. We dole out about $250 million in research and aid a year. And then also I'm really passionate about helping to improve the insurance verification market, which is incredibly antiquated and broken. And so I invested in and chair the board for Verific, which is focused on helping automate the insurance verification market. Getting into it, what does the future of a dental practice's operations look like? I think there's really 3 things that are worth discussing about. And Bill, I'd love for you to chime in with what you see as well. Number 1 is, because of technology changes over the last really 5 to maybe 7 years in dentistry, the idea of a hybrid team is actually possible. And there's 2 major pieces of technology that have changed. The ability to access your PMS from anywhere in the world. Before, in 2015, it started as, well, we could use a remote login tool to view your PMS on your server. Today, due to Denticon and Curve and all of these other cloud-based providers, you can log in while you're on vacation in Palm Springs. And you also have phones like PureLogic and Weave and Mango Voice that allow you to pick it up anywhere in the globe. And so hybrid teams are actually possible. And when hiring during COVID became super bad, when somebody had their biller move away from their corporate office in Florida to Oklahoma, you're like, well, great, we can have you still work there. You're good. Why are we going to let you go? And so the concept of building a hybrid team has actually become something that's generally accepted. Now, when I look at hybrid teams, the common bucket for it would be outsourcing. I thoroughly disdain the word outsourcing because outsourcing generally means I'm going to reduce my cost, but I'm willfully reducing my quality. What we believe in at Reach and what I believe in is that hybrid teams can work remote and physically in person based on the practice's need. But there is no reason in the world that you physically need your insurance verifier in the practice. You need someone to check patients in, somebody to check patients out, someone to build that rapport in your relationship. But do you need to answer your new patient phone calls at your front desk? No. And that's the reason we're so used to all walking into medical practices where there's a super sweet person at the front that says, hold on. And you know they're stuck on the phone with United or Delta, waiting to get that final piece of information. And then they're finally present with you. And so hybrid teams isn't just the future, but I actually think it enhances the patient relationship where you and your team can be focused on the people in front of you. Number two, automation or AI. There is just so much change in the technology being provided to practices today. I hope someday in the future that we will see fully automated insurance verifications that do not require somebody to call in. There is great technology around filing, EOBs or claims and adjudications, and that will continuously improve. But people need to be using automation and AI, whether it's software or AI or both, to find that efficiency and consistency that you need. And then third, I think dental practices operate often as, oh, we have 3 people at the front. And between those 3 people, they manage 22 hats and they co-share them all equally. Well, jack of all trades is the master of none. One of the final things that I deeply believe in is if we can allow people to specialize, we will actually see better scheduling rates, better insurance verifications being completed properly, claims getting paid faster and at a higher rate because the specialization and separating by using automation and also building that hybrid team will allow people to become experts. If you look at the data within dentistry, so many things fall through the cracks because of a lack of specialization or a lack of one person truly owning a function when it's shared by a co-group. I'll give 2 pieces of data about that before I skip to the next slide. On average, with all the practices we see, 56% of overdue patients have not been reached out to with a phone call in the last 6 months. We're just leaving meat on the bone. And then the second thing is the average practice has 32% of phone calls that go unanswered during the day. And because we just have a bunch of generalists, and it's not the people, but it is the structure that we have built within dentistry, is truly setting patients up for a bad experience, staff to be overwhelmed and burned out, and practices to miss revenue and profit that will drive them to be more successful. Bill, anything you want to add?
Well, I know that there's some questions that actually tie in. So if you jump back to that slide real
Yeah.
quick, on the role specialization side of things, I think you're right. You have a lot of generalists out there. Everybody's doing, too many things, right? So you, like you said, jack of all trades, you can't do any of them really well. Is there a position typically that a hybrid team member you'd recommend take over first? Like if there's like is it front desk? And if so, what does that mean? Is it just answering the calls?
I'm going to answer it in a way more obscure way, but there are 2 buckets. Number one, of things that you could possibly have someone remotely do. And the theory for that is if you had a back office in your practice that wasn't physically at the front, anything that you could do in there is what a hybrid team member or a remote team member could do. insurance verification, anything revenue cycle management, patient communication, whether that's inbound phone calls, recare calls, unscheduled treatment. If it's taking place at your front desk, checking patients in, checking patients out, taking payments, none of that should be done by a remote team member. So now that we have the theory of, okay, what could we even do? And you can just stress test the model by saying, can I put this in a back office? If so, you can have a remote team member doing it. Instead of saying, here's the easiest one to do first, I think the bigger question is, where is that solo practice within your organization struggling? If insurance verifications aren't being done, or claims aren't being submitted in a timely manner, or phone calls are being not answered at a 50% clip, that's where you should start. Because as a business, if we solve the most painful, relevant issue, then there's going to be the greatest economic proof and impact to prove that we should continue to do it. But the two most common areas is in phone calls and in insurance verifications. Insurance verification is just the most monotonous but incredibly important to do in a timely manner. And then phone calls is just overwhelming. So those are the two most common we see hired. But I think the better way to look at it is, where's the problem? Where are you bleeding out as an organization? Because it's then much easier to go back to your team and your board and say, hey, we hired 2 people to help pick up the phone calls, and we're able to drive this many more new patients per month because of it.
Excellent. Thank you.
All righty. I just want to talk about how some of these pressures are changing that are leading to these things. I think we all walked out of COVID where inflation went kaboom and said, all right, well, it will calm down. And that is true. But in 2025, the cost and COGS of what was purchased for dental practices rose 9%. And your insurance reimbursement rate did not rise 9%. Second thing, dental insurance reimbursement rates are stagnant or declining. And so you've got really interesting pressures right now where you have a rising floor of cost and you have a ceiling that will not budge, and in some cases is even going down. And that is what is causing this financial pressure across the market that we're seeing right now, where groups are having to pay more for their gloves, for their software, for their triple net rent. And there's not even a marginal gain for the level of cost that we're seeing from insurance company payouts. Second thing that I just want to add here is 40% of practices struggle with patient retention. And so all the time we're looking at new patients, new patients, new patients. If you had to have new blood pumped into you every day to stay alive because you were bleeding out, eventually we're going to run out of new blood. Practices often are focused on the top and the bottom line, and they're not thinking about how are we developing these long-term patients who are going to be with us for 5, 10, 30, and 40 years. And so how are we building a practice that actually has time to call and reactivate our overdue hygiene patients, to call our unscheduled treatment and get them back in? And the second thing that we've seen from making millions of these calls is this builds that long-term patient rapport. When I call and say, hey, Bill, Dr. Pinegar asked me to reach out. He noticed that you hadn't, gotten your hygiene cleaning recently, and we've got Thursday and Friday available at 10 a.m. When works best for you. When done in the right way, we also show people that we clinically care about their health. That causes people to come back. If the practice never reached out to you, you're eventually going to say, well, they don't give 2 hoots about me because they're not even reaching out to let me know.
Yeah, it's a good point.
We as a business, and one thing that I want to be clear on is I'm not a dentist. I have no clinical training. And so our presentation is obviously built around the business of dentistry. And the front desk is where there is just immense pressure right now. And it really breaks into 2 areas where it's fragmenting. And number one is, as Bill said when we were getting started, the Great Resignation was a tool used during COVID where people were leaving jobs at a higher rate than ever. And though it has stabilized slightly, The retention of a front desk team member in dentistry is well lower than it used to be, and it is showing no signs of going back. People look at their careers and their loyalty to their employer different today. And if every year you're not going to step up to the plate with pay increases or promotions, people know that they can go look for another opportunity. That loyalty of having the same person at the front desk for 10 or 15 years is not as common. And because of that, that turnover is a silent killer where you're training, you're getting people efficient, they're learning your patient bases, and that is taking a toll on the model within our groups. Second thing that just causes immense pressure is there is so many things in the day that are not getting done. Unscheduled treatment, recare calls, missed phone calls are getting left behind. And so when you're already struggling with staff loyalty, and then you're leaving meat on the bone of opportunities, it is creating that pressure where we truly do need to change the model. In business all the time, and I'm sure we've all heard, when something breaks, when we talk about it as a senior leadership team, we say, do we have a people person or a people problem, or do we have a process or a systems problem? And what I want to call out is that the fundamental model of the front desk within dentistry is broken. And unless we begin to change it, that same cracking pressure and bankruptcy trend that we're seeing within our market right now will continue and happen to you. Bill, anything you want to chime in?
I was just answering a question here that came in. So how about I'll shout it out now and I can answer it without typing it, and then
Love it.
I'll chime in. So we had a question, just will the recording for this call be sent out? And the answer to that is absolutely. It'll actually be the video recording of this, and it will be up on our website, groupdentistrynow.com, also on our YouTube channel, and we will send you all an email tomorrow with a link to not only that video recording, but also a way to connect directly with Cory and his team if you have any questions or want a demo from Cory. So hopefully, and here's another question that came in, so maybe we'll answer this one, or I'll ask this one and you'll answer this one, Cory. What do the typical annual turnover rates look like now? So you talked about that turnover's still a thing. Do you have any idea on that? I know
Yeah.
it's pretty high. I know with clinicians it's still pretty high. What about front desk?
Front desk is typically turning over at 30 to 33% annually. The average front desk team member is staying 2.9 years or less.
Okay, wonderful. Thank
And
you.
that buoyed down pre-COVID from in the 4 to 5 year range.
Oh, okay.
So
So
you're seeing a 30 to 40% haircut on where longevity of front desk team members in dental were before to where they are today.
got it. Okay, so average is 2.9 years and turnover is 33%.
Yes.
Okay.
Um, what I deeply believe in is that if we don't start as an industry embracing a hybrid model, not an outsourcing model, but a hybrid model, that the pressures on our practice, especially the front desk, which is the lifeline of these practices, will begin to cripple us. And why do I deeply believe that the hybrid model is the practical choice? Is because of those overwhelming admin tasks. Guess what? We can get those removed from the practice. And let's take a step back 1,000 or 2,000 years ago to when we're, dancing around the fire. And an interesting question for you, Bill, is what was the characteristics? I finished a book a couple months ago. What was the characteristics of someone who lived the longest in those, societies back in the day?
I'd say somebody that probably was working. Somebody that was actively working was
Very,
probably one of the characteristics.
very true. And I mean, I set you up with a impossible level question and a specific answer. But the interesting thing is when they go out to survey the feedback, people are like, oh, it's going to be the 6'6" guy who's really strong and can beat everybody up in the camp. What's so interesting is if you look at that early society Aboriginal data, the big strong guy died the earliest, and the person who lived the longest was the most liked in the community.
Huh?
And so, what I think that shows here is for the last 2,000 years, and obviously probably even more time than that, we as human beings have been programmed to be social. And why this relates to the hybrid model is when I walk into a medical practice and they're stuck on the phone for the first 15 minutes where I can't even check in on time and they don't know who I am. I hate it because I, as a human, want to connect with people. So, why do I think the hybrid model matters? Is because it pulls the things away from the front desk that prevent people from actually connecting and building a relationship. We can talk about the costs and all of these things that are left on the bone. But when we also do that level of specialization, we give the front desk the time back to connect with human beings. And we are psychologically wired to want that.
Yeah, that makes quite a bit of sense with all the distractions, all the tasks that they probably don't want to do for a lot of reasons. Verifying insurance sounds like a lot of fun, right? And yeah, it does take them away from interacting with the patient. And I would think there's probably some, and I don't know if you have any statistics on this, because a lot of times, front desk is involved in treatment acceptance as well, right? Do you want to book that appointment now? Doc says you need to do this. So there is that sales role almost that they have to a degree. And I'm sure, when you are more liked and you're freed up from those tasks that you don't necessarily want to do, you probably have higher treatment acceptance. And that was actually one of the questions that came in too. Is there any tie-in to a hybrid team versus an uptick in treatment acceptance?
Even more than that, the average practice currently in the US right now is sitting on $2.4 million of unscheduled treatment that they're not reaching out to. So obviously, when you're checking somebody out, your reappointment rate will be higher, your close rate will be higher because there's actually time to have those conversations. And then because we have somebody else focused on getting the new blood and existing blood in easier, when you have a 5-minute break at the front, when I have a 5-minute break between a meeting, I'm not hopping into I'm not pulling a list of Excel and starting a accounting audit. I'm taking a breather and I own the damn company. And so I think about our teams where it's like, okay, yeah, why are you not calling the recare list or the unscheduled treatment list? It's like, well, what if you actually said, we're going to pull someone off, we're going to put them in a back office, and from 12 to 4 every single day, they're going to call the recare list on Monday, Tuesdays, and Fridays. And on Tuesdays and Thursdays, they're going to call the unscheduled treatment list. And then you're getting people in, you're closing at a higher rate. And it's that flywheel of motion where your hygienists and your doctors are busier and your patients have the relationships and care to actually commit, schedule, and follow through.
Sounds good.
And one thing that I haven't called out super well today and want to share a little bit more on the math is we believe remote is essential to create the margin that businesses need to be profitable and sustainable. We just talked about how cost is going up and revenue per patient is pretty stagnant. We as a company do not specialize in US talent. Costs within the US today are just bonkers. What we specialize in is building that hybrid team internationally. Now, whether someone chooses to hire through Reach or not is not the goal of my presentation today, but I want to talk about the math. The average front desk role in the United States, when you factor in healthcare and taxes right now, costs $3,840 a month. If you are hiring a remote and international team member, you are looking at, at minimum half the cost savings. And so if you're able to take $2,000, just to make it rough math here, and have that be monthly cost savings per team member, that's $24,000 a team member a year where you can pay your on-site team more. You can retain your office managers. You can retain your treatment coordinators. And you can have the margin to pay the debt and the service and meet the liquidity and margin you need as a business. And that is where I think the math of this makes so much sense for giving the margin where people can then invest and run a business that is actually sustainable. Otherwise, you are hanging on by the nails on the back of your car, getting drugged down the street. And that's the way we work with a lot of groups and a lot of great operators. So many of them are barely hanging on due to the model's pressure. And I shared this with Bill, and I'm going to pull up my calculator to do it in person right now when him and I were chatting last summer. But we just spoke a minute ago about how on average, when you go international and remote, there's about $2,000 a month in cost savings. And so you've got $24,000 of, contribution margin a year more. Now, let's go and say, all right, we're going to have 50 remote team members. Your annual cost savings or additional contribution margin is $1.2 million. That's impactful in paying down debt, servicing your team members, and meeting the EBITDA requirements that are necessary to sell the business in the future. And that's tangible today, not futuristic. And let's just say you got offered an 8x multiple on your business off EBITDA. Well, what is the actual value that those 50 remote team members would provide an increased enterprise value? It's $9.6 million. And so we're not just talking about properly not burning out the front desk, but what I love about business is where you can find a solution that is financially lucrative, takes better care of your patients, and at the same time takes care of your team members. Well, guess what? The phone's picked up more. People are reached out to more often. Your patients get better health care. Your team actually has the margin to get paid more, and they're not managing 22 tasks. And the business has the EBITDA and margins it needs to treat its team right, treat its patients right, and be financially sustainable. And that is what I think is so compelling about moving to a hybrid model.
And I've got a question for you there. So your that number was using 50, right? Is that what it
Mm-hmm.
was? 50 remote team members?
Yes.
Okay. So even if we took a zero off and we were down to five, we've got a lot of emerging groups here. So you replace five, you're still looking at almost $1 million, right? And $960,000 in increased value. So still, a pretty big number for a small group. On average, when you look at like from a practice count standpoint, if somebody's going to look at replacing or bringing in a hybrid member, do you typically see one per location, two per location? Again, I know it really is depending on where the need is, but do you have any thoughts on how that typically plays out?
One per location is your average. And as you scale to, 20 locations and above, there's economies of scale where you have such a great shared pool of team members and people that are experts that you could maybe even have only 0.7 of a team member per location because they can share the love with that greater pool of people. But the easier way to think about it is definitely just a one team member, one location. But again, it's very niche on the configurations, but it's an overall good school of thought.
Oh, that's great. Another question that came in here. Can Reach also assist practices in acquiring the necessary hardware and software solutions to accommodate remote work? So a lot of people have not had a hybrid team model before. So what's the requirement on the group and the practices as far as like, hey, what do we need to communicate with this hybrid staff?
This is a awesome question. So kudos to whoever brought this. Our goal is not just to give you the labor, but to help you efficiently use the labor and to set up the labor. You're assigned a enterprise account manager with us who's actually guiding you through what phone systems best work. What are the best remote access tools if you've got an on-prem server? Or what are your best cloud systems? So our goal is to make the journey and integration of training a team member, knowing the technology that it creates. It's not just to, bring you a VA and say, hey, Bill, here's Maria. You guys are going to do awesome. Remote work's new in dental, and people know that they need to do it, and then they commit to it, and they kind of look like a deer in the headlights. And our goal is to truly drive success. Because if we bring you a VA and 90 days in, you say, hey, they were great, but it's just not working for us. We didn't set you or our team member up for success by helping you have the best practices and tools to actually make the relationship successful.
All right, and another question I think it might be worthwhile asking now, and this is one off of the questions from the registrants, and I think a lot of people think this, especially if you haven't had a hybrid team member before, and we've all experienced this. What about the language barrier? What can I expect? What I don't want is the experience that we all sometimes get when
You
we
call Wells
call.
Fargo or T-Mobile and
Yeah,
you're like, hey, did I call the right number? Or is my social security about to be gone?
or Rocket Mortgage, which I just had this experience with last week.
So I'm gonna flip this back on Bill to make it even fun. Bill, you know Jonathan on our
I,
team very well. You've met with him plenty, you've met him in person. Jonathan lives on a little island off the coast of Brazil. How is he when you talk to him? Give me your genuine feedback and experience.
better English than most people that live here in the States.
An accent.
Uh, no, not at all. I mean, the only reason I know that he's not from here is because he told me. But yeah, now he's great to work with, and yeah, no accent and command of the language is great. Now, is that so? So do based on my experience with Jonathan? How do you ensure that you've got that with all your employees? Is there a specific area of the world that you work with, or are there certain pool of talent that you find best to work with?
Great question. So there's two different things I'm going to answer here. We When we're looking at phone roles, and the vast majority of our roles are filled out of Latin America, we're just more similar culturally. The obviously Spanish speaking component is a very important component for practices today to have that ability on their team. And so Latin America and then also the Philippines. And the Philippines is really valuable because you can go hire people who have actually worked for Delta Dental, United, and people who have multi-year experience in insurance verification and revenue cycle management. The Philippines has a slightly more heard accent. So if I were doing phone calls, it's Latin America, but they serve both dual roles. The second thing is because the money is good that people are getting for this, what we would consider to be a base level job, we get an incredible amount of demand. In November of this last year, we took in a 30-day period, and keep in mind, we're not running LinkedIn ads or Indeed or anything like that, but on our website, we took 31,900 applications and we hired 98 people. Our average acceptance rate for last year was 0.2%. And so you're right. There's people around the world that have really thick accents or not great English. We can be incredibly picky because of the level of application and demand, because of how far the money goes for where the people live.
Great.
Awesome. I know we're cruising through our time here, so I want to begin a little bit more of my wrap up as we lead into some more practical things about building that hybrid team and also talking about those other areas we believe practices can continue to innovate. What we as business owners and operators need to think about is not over optimizing our team. If you look when Dentrix first became a player in the late 90s, that was the only piece of tech used in a practice. Well, today you have that. You have patient engagement tools. You have revenue cycle management tools. You have technology for insurance verification, for submitting claims. You have radiograph tools. What we each need to think about, and there's no right answer, is, are we just stacking to be busy or are we stacking to impact? And if you think about the hamster on the wheel right now, one thing that we're consistently seeing is people thinking that adding more is going to produce more output. And as you continually look at the innovations within the market, I'd encourage each of you to keep or kill what you have, to have that tech stack where the tech is truly enabling your team and not making them just toggle between a bunch of solutions that then you at the end of this year will look at and say, we didn't even use the value of them. But something that we're hearing about from front desk team members and even seeing is a low lack of utilization because of that endless stacking of technology and systems right now. And so it's really important as we look at the AI and things out there to look at what actually makes a difference for our patients and our profit. Let's keep those things. And if something's not getting utilized or driving us the outcomes that we want, let's get rid of it. But the practices and groups that we see under the hood in a very intimate way, the practices and groups that are doing so well right now, you go underneath the hood and you see the simplicity of the design that they've created, which allows them to execute the model at scale. You asked this earlier, but as we begin to wrap up, just want to briefly hit it. These are the areas where you can build that hybrid team, where you can offload. And there's obviously more than that, but these are the biggest areas that are getting left behind from not being done. And they allow your staff to be more focused without diminishing the patient experience. And so if a group is able to do this, what does that actually do? And we've been able to do some studies with some of our groups who have been with us 5 to 7+ years. And what's so interesting is there is higher reported patient satisfaction because the phone's picked up, because the billing is done properly. The second thing is the practices are actually seeing increased revenue per team member because they're focused on tasks that are otherwise not getting done. When a group goes in and looks at a VA that is focused on the missed opportunity area, unscheduled treatment, recare calls, inbound phone calls, the average practice is seeing a $19,000 a month increase of revenue if they're focused on the areas that are getting neglected. This is not if you're replacing someone who's already doing the same role, but if you have people that are focused on those areas that are too often neglected. Second thing is, we all know with the great resignation and some of the workforce attitudes of millennials, and I can say it because I'm a millennial myself, can bag my own kind, that there sometimes is not a great attitude. And what we see, and blows my mind in a humbling way, I've done 3 interviews this morning for roles that we're hiring for internally. And they are grateful and excited and engaged in this, not just being a job, but it being a career. And when you have that type of energy and commitment at your front, it creates a completely different experience. And right now, our average team member has been with us almost nearly 5 years. And so if we're able to compare those two numbers that you asked earlier of 2.9 years is the average retention of a front desk team member, and we're at 4 years and 7 months, you're going to have an engaged, bought-in person into their career sticking with you longer. And the final thing that really building that hybrid team, as we've talked about with that calculation we did a minute ago, is if you have a 1-for-1 labor replacement, you're going to cut that cost, the cost of staffing almost in half. And that creates margin where it's not about being cheap to our people, but creating the team based on the structure we need to even treat the team we have right. But this idea of keeping it all in-house when the business is on the brink of bankruptcy is rude to everybody. In closing, and number one, I just want to say a huge thank you to everybody who's taken the time to learn a little bit more about Reach and the hybrid model. I just want to share what makes us unique. Number one, We are not a staffing company. In healthcare or in the greater world, all we do is dentistry. We understand what training around EagleSoft and Curve and Archie and Weave and Pure Logic actually look like. And there's three things that I believe separate us or make us unique in the market if you eventually look at building that hybrid team. Number one is we really do believe in getting you the right long-term fit. Oftentimes there's such pressure to fill the role within a practice that I feel practices operate under the model of, well, if they check the box and have the experience we want, we'll take them. I heard a guy years ago, and I hated it, say, if they live, breathe, and fart, we'll hire them. And I think that's why practices have such high turnover. What we believe in is you can come to us and say, I want someone working 8 to 5 Mountain Standard because my practice is in Utah. I want them to speak Spanish and English, and I want them to have a charming sales personality. We're not going out there and saying, oh, we're just looking for someone who's got 2 years of insurance verification experience. We want to find the right fit, the right puzzle piece to work well within your practice so that it's a long-term and enjoyable option for you and them. And you make the decision on who joins your team. You're not coming to us saying, okay, here's what I want. And then we bring back and say, hey, Bill, here's your pick of the litter. You're going to love Jonathan. You do the final interviews so that you can say, that's the member of my team. We're not into outsourcing. We're about building the hybrid team. Number two, many of you are running groups that have different pieces of technology in different locations. We have built something called Reach University. And when you have a new team member start and they're going to work for the practice that has Denticon and Mango Voice. Well, guess what? You go in there and you say, I'm going to assign them training on recare calls, Denticon, how to pull the list in Denticon, and how to make outbound phone calls in Mango Voice. And our system builds a unique learning journey. There are 200,000 practices in North America. Almost all of them are a unique combination of different pieces of technology, and then all of them have unique roles within them. What I look at with what we've built with Reach University is almost like Lego blocks. Bill could go build the Battleship Galactica, and I could go build a Ferrari out of the same Lego blocks. We then have built training that's flexible to build the people around the technology and roles that they're going to be within. Training is a beast for organizations. Now, we can't train on the nuances of your group, but we can make that base layer, that 80% option, really good. And this isn't about 1 or 2 weeks of training at the beginning. These are tools that you and the team members can access with us anytime at Reach. And then third, Bill, you said it in an indirect way when we talked about accents. We're going from having a front desk that is down the hallway where I can see how they're doing to remote. And when you're breaking that or making such a significant change, people will say, well, how do I know what they're doing? And instead of saying, well, today Bill clicked his computer mouse 92 times during the hour of 1 to 2, we have built a performance tracker where you can go in and see the number of new patients they scheduled today, the number of text messages that they've handled, the number of insurance verifications done, and it's live. You can toggle by location, you can toggle by team member, and I think, I'm biased, the coolest option is that you can set goals of what does success look like in the role. And so when that team member's in there every day, they can know, okay, the goal is X number of new patients or X number of outbound recare calls. And every Monday, you get a breakdown showing you exactly how your team members have done from a data performance perspective, but also towards the goals that you set. And that's what I think makes us such a great partner in building that hybrid team is finding the right people, building that flexible and expert level of training, and then providing the data to make the argument damning and not, oh, I think they're doing good or I think they're not. And that is what allows us to really give the market a very complete solution. In closing, super grateful to share a little bit more about what we think the future of dental groups and dental operations look like. And whether you choose to use Reach or not, I genuinely hope you all walk away knowing that the hybrid future isn't just an option, but I genuinely believe it needs to be a reality. And with the bankruptcies and bank involvement we have seen just in the start of this year, I hope it shows people that we have to change our industry for the practitioners, for the patients, and for the staff. And so if anybody has any questions, I am happy to chat anytime. I genuinely love what we get to do. And I hope people can see over the coming years how good the international community really is. I had a lot of misconceptions before I got into this, and those have been shattered by the quality of people that I get to work shoulder to shoulder with every single day.
Thank you, Cory. Great stuff. You left us with a little bit of time, so we're going to ask kind of rapid fire with some of these questions, if that's okay with you.
Absolutely. Hit me with the hardest.
All right, that sounds good. And everybody, make sure that you scan to learn more, and you can claim that $50 gift card. Cory, how about if somebody has a question for you? What's the best way, or somebody on your team? Is it scanning? Is that still the best way to do it, or best way
To
to
meet with
connect?
our team, scanning is the quickest way and
Okay.
best way to meet with them. If anyone has a question for me individually, connecting on LinkedIn, shooting a message, or Facebook. I know the dental market's unique and people using both of those quite abundantly.
Yep.
But I am on both of those for too many hours of the day and genuinely love the opportunity to get to connect with people who are doing this because it allows us to build a better company at the same time.
Excellent. All right. Well, and we'll put Cory's contact info and also drop a link. So if you can't scan that, we'll get you the URL so you can just click on that link when we send you that email with the recording of this discussion tomorrow. So hardest part about implementing a virtual assistant.
For a group, often the decision is coming from your C-suite of operators, and they're going to office managers and front desk team members who almost feel defensive or threatened by having remote or international people to work with. Our goal as a company is not to eliminate people who are hardworking. We believe that those are the backbone of America. And we don't want to look at our product as a competitor or eating at the same niche. And so I have noticed when we have a solo practice come, they're all discussing it as a team. Oftentimes with groups, it comes down as some corporate level mandate or decision. And so it's taking the time to explain to the practitioners and office managers and team members, just as we've done today, that this is actually about building a support system to better compensate them, to reduce them of their stress. But when an email goes out at midnight from a regional manager or an EVP of operations, it doesn't go well. And so it's about investing the time to explain the change and explain how it will truly benefit everybody. Then it goes really well, but it's taking that moment to pause and explain and have conversation. When it doesn't, it does not go well.
All right, I'm going to combine these two questions because they're similar. First, I'm going to ask them both, but you'll get it in a second when I ask them both. How do you plan to work with AI, and how to best integrate various tools to increase performance? I think that second one is more like, what tools do you recommend that can help, and then can you use AI to kind of enhance these hybrid, are they using AI solutions? And are there some that you think of are just kind of no-brainers at this point?
Awesome question. I literally had a meeting about this morning. Um, I'll make an analogy because that's how my brain thinks. And I think about a sewing machine and a seamstress. The seamstress is the expert and leads and guides the sewing machine to be more efficient. I look at what we provide in those hybrid and remote team members as educated experts that can help in the niches. And I look at AI as the enabler to be more efficient. And when used independently, you have 1 point for each of them on each side. Together, you have a 1 + 1 = 3. Now, there's a bunch of different products in our market today. Obviously, there's Claude for generalist tools, and we train our team members even how to write and manage better prompts within these systems to be efficient. Um, the dental market is rapidly innovating with AI. I'd say your radiograph and your insurance verification market are probably where you've seen the most innovation. Phone calls is still coming. It's a great solution for after hours right now, but we as a company want to embrace it because we believe it's the supercharger or the steroids of a more efficient and simplified operation. It is not one versus the other. It is them stacked on each other. We don't build AI, but we train on it. We're looking to partner with great tools. And our goal is to give the great human beings who are trained and engaged in using those products.
All right, here's another tough one. Maybe we'll end on this one here. Um, People have concerns about cybersecurity and HIPAA and things like that. So how do we ensure that, the hybrid team is upholding the same standards that the practice or the group is?
A fantastic question. It's why people ultimately hire a vendor. Because guess what? When it goes wrong, and luckily in our 9 years, it's not gone wrong. But when it goes wrong, it is our liability. We sign a BAA. We are a covered entity. We own multi-million-dollar cybersecurity errors and admissions and policies beyond that because our goal is to bring the cost-effective people with the right technology to truly make it secure. We have a full-time director of IT in-house who just leads the security aspect of what we do, and we're updating it consistently because cybersecurity changes all the time. And so our goal is to be a partner there. And we have a full-time in-house legal team who's looking at how compliance and laws are changing. What we're not is just a provider of warm bodies. Our goal is to be a partner in building those remote teams where if you're going to go hire 5 people, is it worth it and hiring someone to lead the strategy of how do we securely set up that remote team? It probably is not. Why do people hire AWS instead of building their own servers today? Because AWS knows what they're doing at scale. We have thousands of team members around the globe, and our goal is to bring that cost-effective compliance and security, also knowing that if something did go wrong that was within our world of control, we are a partner as part of that equation. Hopefully those days never come, but we prepare and act for like we are prepared for them to show up if ever needs be. And that's why we don't want to be just a vendor, but we want to be a partner in our industry.
Excellent. I think on that note, we'll give everybody 2 minutes back, finish up a little bit early, and thank you, Cory. Really appreciate it. Make sure you scan. Again, we're going to send out an email tomorrow with a link to this recording, how you can contact Cory and how you can reach out to the team and learn more at Reach. So again, thanks everybody for joining us, and thank you, Cory. Great information. Really enlightening.
Thank you, everybody.